Bismillah ar-Rahman ar-Rahim. Now, my Professor Dr. Sayyid Ali Azhar. I am visiting professor of the medicine of Jinnah Sindh Medical University, Karachi. And I was talking previously on the module of infectiology. Infectiology means that the infection and the disease process. They combined each other and make a subject of infectious diseases or infective diseases. And there are certain terminologies which I have shared previously with you. And my previous terminologies are the basics to understand this type of discussion on the infection. Let's see the applied side of this. Scenario is that a 30-year-old patient known case of the rheumatoid arthritis was on steroids and methotrexate for the last 6 months and attacked by high-grade fever associated with the left chest pain and dry cough for the last 10 days. She was on therapy suggested by her general practitioner, and recently she was completely bound on the bed with oliguria and disturbed consciousness. This is what we happen in the most of the cases you see in your medical HDU or medical ICU. In some cases you will also see in surgical ICU and gynae ICU, obstetrical ICU. On examination, this is very clear-cut story of a patient. And on examination, patient was drowsy, temperature was 104, and pulse was 130 beat per minute, tachycardia, dehydration was positive, and the bronchial breath sounds the medium curve in the left lower and the middle lung. Bronchial breath sound. What are bronchial breath sound? Inspiration is equal to the expiration. Inspiration as harsher as expiration, and there will be a clear gap between inspiration and expiration. And they are very characteristic of the consolidation or a mass directly in communication with the bronchus. So see the examination, patient drowsy, temperature 104, pulse 130, BP was 70/40, which is definitely hypertension. Dehydration was positive, and there was a evidence of pneumonia in this patient. Hemoglobin 9.7 and total leukocyte count is 3,400. It is lesser. Anemia is there, and there will be a leukopenia. Platelet is 50,000, which is also thrombocytopenia. The random blood sugar was 74. Sodium is 122, which is less. Potassium is 3.5 at the margin. Fluoride is 100, and bicarbonate is 24. Normal up till this stage. The blood urea is 76 higher. Serum creatinine was 1.7.5. So you cut serum creatinine with the blood urea, which is more than 1:40. It means that it is pre-renal. If it is less than 140, it means that it is renal inner region or post-renal inner region. This type of renal compromisation. X-ray chest revealed non-homogeneous radiopacity in the left hemithorax. It is non-homogeneous radiopacity in the left hemithorax covering the lower zones mostly. So the patient had developed a consolidation, probably the pneumonic consolidation. The questions are always four. What other investigation might be helpful? And list your differential diagnosis. Describe the pathological diagnosis, explain this pathogenesis also, and how will you manage. Now, in most part of our center, the thing is this: when the patient arrived in these situations, there will be panic. There was a protocol. The medical officer, they are following the protocol, which was given by the administrator. If these type of the patients, if they arrived, then you will do these things. And call your senior, and then you can call the junior consultant, and then call the higher consultation. Now, I mean that steps have been taken. For example, this patient was was admitted in some tertiary hospital. What they had done on this patient. And this is actually the art of medicine. Today, nowadays, in most of the cases which are arriving in the different parts of the country, in secondary care hospital or in tertiary care hospital, the oath they have already taken on acquiring their MBBS degree or MD degree, whatever the degree they have obtained in medicine, they have taken the oath that they will serve humanity. That this is gone. Because nowadays, the health system is nothing but the health industry. You have to generate money from the unit, whether it is a primary unit or a clinics or unit or a secondary or a tertiary care hospital. Because I have also admitted in some tertiary care hospital at one time, and I saw what they have done. They don't know about me that I am the senior professor of medicine, or I am the senior examiner of medicine at fellowship level. They don't know about me. They were doing the protocol which were written on the piece of paper. Some are justified investigation, and some were unjustified. They cannot justify it. The thing is this: after this, the story which I am telling you about myself, their diagnoses have been made. They say that you have involved, your myocardium is involved by ischemic process. There's an argument between me and the medical officers who were attending me at that time. And I proved them that no, this is not the thing actually in your mind. Always manage. You have to do the general measures, yes. That is why I have divided the management into general measures, or we do the specific measures, we do for symptomatic measures, we go for the what is you call prophylactic measures, preventive measures, the dietary measures, and these local measures and the surgical measures if indicated. And this is the lines of management. The lines of management were not followed correctly. It wholly dependent on the investigations. One investigation, second investigation, third investigation. Some are justified investigation, no doubt. But just some of the investigation, about 40%, are not justified by them. If my myocardium is damaged very badly, how can I, had walked a distance so much from the gate of that tertiary hospital to the ICU? And there was no, apparent breathlessness apparent breathlessness, although my respiratory rate was higher, 25, 24 per minute, yes. So I mean to say that if you are a physician attending as medical officer at ICU, at casualty, whatever the place is, you have taken the oath that you serve the humanity on the correct path. But this principle is not followed. And nowadays, the medical or medicine or health issues, they are turned out to be what is called as, it is not the health department actually. They are health industries. They want to generate money as much as they can. I'm sorry, but this is the fact. And there is no doubt about my statement. I own this statement. Because I was the target at one time. You don't know that I was a professor at that time, and I am senior examiner of fellowship examination in medicine and at CPSP. They don't know about me. So what about the common patient? They are doing to the common patients which are coming. I'm very sorry, but there should be some rules and regulations should be followed. The beneficent is definitely the patient, not you or your institute. Remember this message. From these statements which I have told you about this, the story of a lady who arrived in this situation, or I have told you my story at the time of the admission. The extract the soft data, and she was lady and she has some past history significant, etc. And she has pre-renal or renal azotemia. We don't know exactly the position here, but it seems to be pre-renal azotemia, etc. Extract soft data. So hard data, yes, there are a lot of hard data in this patient. He has exposed to some infection, an infection from which route? Now, try to understand the portal of entry of the infectious process. And then what happened that I have already told you previously. The stages are transient bacteremia, there will be bacteremia, there will be septicemia, there will be pyemia, there will be systemic inflammatory response syndrome, there will be sepsis, or they will go into the septic shock, or post-sepsis syndrome, or they can develop what is known as the MODS, the multiple organ dysfunction syndrome. This possibility, stages are going on like this, MODS, and in between the DIC may be possible, disseminated intravascular population. And then the patient can develop the other, the terminal states, which I say, the hemophagocytic syndrome type of a problem. These are the stages of any infectious process which is developed from any port of entry. There is some enlargement area, and then the process starts, and the body reacts against it. And the result, what happens, is in front of you. That the patient has stuck data, hard data means that you have collected the points which can be indicative of the most probable diagnosis. Leave what is the type of infection, I don't want to discuss. I want to discuss only one thing, and that is that patient has developed some infectious disease. This patient is in the transient bacteremia, no, or bacteremia, no. Septecemia, yes, probably. SIRS, all features are present of the systemic inflammatory response syndrome, yes. More than six, sepsis means that it is the high number of the microorganisms which are cultured and proved. He is in septic shock, she is in septic shock. Yes, she is in septic shock. Either she has developed the MODS, yes, she developed MODS also. In this case, you can see the multiple organ dysfunction is there. It means that the patient has very severe problem now. Don't take it easily. You have to manage it in any way. So, accept soft data and then accept hard data, and the questions when we asked here that the XH has revealed non-homogeneous radiopacity in the left hemithorax. These were there. Scenario. Now I just revised it for you. Describe these terminologies. Already said transient bacteremia, pyemia, septicemia, sepsis, septic shock, MODS, hemophagocytic syndrome. Previously described in my video lecture. Please try to listen that video if you want to gain knowledge. So this is a sepsis, no doubt about it. First is the sepsis. The patient developed the sepsis. Means that it is proved by the labs that the infection has occurred by specific microorganism. It was cultured and the sensitivity was provided. It will take 2 to 3 days, 4 days, 5 days. But presently she is in systemic inflammatory response syndrome, turn out to be afterward to the septic shock and MODS. Sepsis is an inadequate reaction of the microorganism to the action of the microorganism at the acute magnetic and decreasing reactivity or paralysis of the immune system, because at that time the first line of defense, the second line of defense, the third line of defense, and the fourth line of defense all are paralyzed. This is a war between the system, protective system, and the microorganism. One has to win this war. Either you are able to combat that infection or curtail that infection, or you cannot. It means the microorganisms, they are superseded your system. And that is the sepsis actually. The features of sepsis which select him or her from the other infectious diseases is a polyetiological disease, definitely. It may be caused by many microorganisms. All microorganisms, all can cause sepsis. But foremost are the streptococcus, meningococcus, clavicillus, and blue pus stick and mixed infection also. There are a lot of new organisms described. The epidemiology feature is that it consists in the non-contagiousness of the disease. Sepsis is not reproduced in the experiment. We try to do the experiment, and in parallel to this, you cannot generate this non-contagious of this disease. Because what is developed is developed. No, it is not coming out from the mouth, it is not coming out from the urine, it is not coming out from the feces now. It is the disease of the different parts of the body and fixed there. The clinical feature, the cyclical absence, it is impossible to select the periods which characterize other infectious diseases, no incubation periods. You cannot, imagine it, the incubation period, what is the exact incubation period. The clinical manifestation is same for the different agents. Whether it is streptococcus, whatever it is, Schinmadia, The clinical manifestation will be the same, resulting in the septic shock. Immunologically, the immunity is absence, maybe hyperactivity and unequal reaction. Even immune hyperactivity will dangerous phenomena. Specifically speaking, very recently, the coronavirus study of the coronavirus, I have done 800 cases. Was also the victim of this. And I was admitted because of the coronavirus. So here there is a hyperactivity of the immunological system. At one time it was activated and then the destruction occurs. Mostly by the, not from the microorganism, but by the immunologically mediated mechanism created by the coronavirus D. And the other organisms as well, they do the same. And pathogeny means local and general changes haven't specific peculiarities. Local general changes have not specific features. Entrance gate. Entrance gate is that first is the portal of entry, whether it is from the nasal or the oral or IV cannulae of the mouth, urinary tract, or the urogenital tract, I would say, genital tract, or from the peripheral parts of the body. For example, osteomyelitis of the tibia. At that part, the entrance because of the trauma, the patient was, developed the cellulitis and compartment syndrome, localized as afterwards a localized septic locus in the bone as osteomyelitis. Now here is osteomyelitis or anything, whatever it is, abscess or whatever it is. Now organisms, they are encoded by a membrane, biogenic membrane that is called. And they multiply and multiply and multiply and multiply. And a gush of the microorganism come into the blood. Lot of organisms entering into it. So much so, you cannot, enumerate it even. It is not possible. But they damage the systems. Systemic inflammatory response syndrome, shock states, the multiple organ dysfunction, and at the end of the day, the hemophagocytic syndrome and the death occurs. The chronic abscess of the pancreas, here a lot of inflammatory cells are seen here. That is the lymphocytes and the fibro and some giant cells are seen. Local manifestation can be as lymphangitis, it be thrombosis or the lymphadenitis, or phlebitis, or thrombophlebitis, or thrombobacterial emboli. Thrombobacterial emboli. This is what I can say lipemia. Anatomical general manifestations. The thrombosis of the mesenteric artery can occur. It may be dissemination of the thrombosis, that disseminated intravascular coagulation. In the recent, experience of 1 year, 2 years, they are terrified from this disease. At one time, this disseminated intravascular coagulation, they are, a bad nightmare for the gynecologists. The patient goes into the DIC, of course, it is very difficult to manage. But nowadays, the other organisms as well. It may be from the lobar pneumonia. It can come from the abscess elsewhere in the body. So focalization and localization doesn't mean that the subject is over. No. Aplastic nephritis. Nephrons are at stake. Means that if you do the biopsy, you will see the response of the body. And the septic myocarditis. Now, I was suffering from this. It was septic myocarditis. They said that it is ischemia because the STT changes was there with the very high levels of the troponin I. So they labeled me the ischemic heart disease, ST innovation myocardial infarction. And they want to do the thrombolysis, and they are planning for the coronary angiography, and then doing the PTCA or CABG. In my case, and the highest tertiary level. This hospital is regarded as one of the best tertiary hospitals in Pakistan. And they said that I have developed this. So I showed them in the mobile there were studies going on for the disease process. I showed them that these are the latest articles. See how the troponin I and T and how the STT changes occurs in septicemia. I developed septicemia actually on that. And it was the pneumococcal type of a disease which I had, not coronary, because coronary was not demonstrated at that time. It was not negative. Because 10 days elapsed, I was negative for the coronary test. But they said, no, it is this problem that you have developed DIC and you have developed this and this and this and this. Wrong pathway has been taken by the attending officers. On primary bacterial endocarditis, for example, the infection occurs in the throat and lodges in the, then afterwards into the localizing and focalizing in the endocardium. It may be the mitral valves and aortic valves, healthy valves. There will be a hemorrhagic syndrome with jaundice. For example, Clostridial pneumonia infection. Specifically, I'm telling you of the disease Clostridial pneumonia, which causes the hemorrhagic type of a pneumonia. And then because hemorrhage occurs, the extravascular hemolysis and jaundice appear. It may be directly invasion of the liver. Yes, I had previously told myself that the LFT was deranged at that time, which I was admitted. And there was a reactive bone marrow hyperplasia, enlargement of the lymph nodes, and the spleen was also at the stake in this patient or other patient, may be possible. According to etiology, sepsis is divided into staphylococcus or Calibacteria or myocardial salmonella, any bacteria, any I already said spirochete, any parasite, any fungus can do this. Classification according to the motion, whether it is lightning type, means that it is the patient was all right 6 hours before, and none arrived in the ICU. As a nightmare, of course, a septic shock, lightning. Acute means that it takes time, but in my case, it is 2 or 3 days. But I developed septicemia. Subacute means after 15 days or the third week, rather mostly. And after 1 month, it will become the chronic type of a problem. That is called post-sepsis syndrome. According to the infection antigen is concerned, it may be a therapeutic para-infection. Cannula Paskia, urinary catheter, tonsillar, it may be surgical, it may be uterine, it may be autogenic instrumentation, it may be odontogenic, it's a common one. Dental surgeon, umbilical, and it may be cryptogenic, you don't know. Cryptogenic means it is hidden, latent cryptogenic. How many of you have seen a patient with tuberculosis arrived at septicemia? It means that which I want to say is mycobacterial tuberculosis septicemia. I have seen 2 or 3 cases like this. It is actually disseminated tuberculosis or miliary tuberculosis, and it is nowadays also leading to the multiple problems. It was demonstrated in the blood culture. The patient goes into or went into the septic shock there. Septic shock, or here you will say the mycobacterial shock, and the multiple organs dysfunction syndrome was demonstrated also. According to the clinical sign, the septicemia, septocosi, biemia, septic bacterial enteritis, and chorion of the placenta. According to the clinical sign. The stage of the pathogeny, syndrome of the systemic inflammatory answer, destruction of the endothelia, mediators, cascade. I have already told you that I was taking shock, and I think I have taken 9 or 10 sessions on the shock. Nobody was interested actually to see those videos, 9 and 10 videos on the shock. But if you are interested in clinical subject like me, internal medicine, then you have to see these videos. Or septic arterial hypotension, or septic shock leading to cardiac weakness, violation of the microcirculation, and there will be the polyorganic insufficiency, shocks in kidney, renal failure, distress syndrome, and others. Septicemia means a lot of bacteria in the blood and multiplying in the lymph nodes and multiplying in the reticuloendothelial system, and they are stimulating the bone marrow, and you will see the immature erythroblastic cells response against this infection. The body responds against it. You know that cellular immunity is generated and the hemolytic immunity is generated. These are some of the slides showing the septic myocarditis and hemorrhagic type of pneumonias, and the septopiemia actually is piemia, because lodgement is in the form of the multiple abscesses in the lungs, in the spleen, in the liver, seed as a bone of stimulatis. Elsewhere also, no part is exempted if it is piemia. Any part can be involved, whether it is heart valves or myocardium. The endocarditis features has been explained here. And these are the slides that are showing the response against this, the changes in the lungs and the kidney in the septic shock. Lungs also are at the stake, and the kidneys are also at the stake. And there are specific changes in the histopathology response against the infection. The peripheral signs are ligaments, petechial response, ocular palmar nodules, finger drumsticks. The petechial hemorrhages are there, there are ocular nodes. They are present on the hands. Fingers are clubbed, local necrosis in the subcutaneous tissue, genuine lesion may be there, because it can occur in the endocarditis or in the case of the septicemia. Both can cause genuine lesions because of the vasculitis. And there will be a jaundice, and it is definitely the jaundice, most probably it is the extravascular type of hemolysis. Management, yes, of course. Management, always management. If you are asking somebody management, a shock occur with the candidate. Management, because how will I explain this? Divide into general measures, specific measures. General measures, specific measures, do the symptomatic measures, preventive measures, if it's possible. Do it dietary measures, do it local measures or surgical measures if applied. Divide into these. The first one is general measure, second one is the specific measure, third is the symptomatic measure, fourth is preventive measure if you can do, if indicated at this time. Fifth, you go for the dietary measures. Sixth, local measures. Seventh, surgical measures if indicated. If you are writing a prescription, for example, do like this. If it is not applied, write it down, not applied. Now, bracket में करते हैं उसको. Do it in like this. General measures. When the patient is shocked, hypertension, manage the hypertension. General measures are very important here. The foot under the bed is raised to pull the blood most to the going to the above in the vein, because the transcerebral perfusion is very low in this patient. A Glasgow coma scale is hardly 8. Very drowsy patient, not responding. And manage the shock. That is ultimately very important. The shock should be managed. Hypertension. So pass to 1 cannula, 2 cannula, cut down it, whatever it is. That should be definitely, it should be isolated. The patient should be isolated. We don't know the type of the infection, we don't know still. Therefore, it should be isolated. He should be isolated. And proper handling should be there. You should wear the gloves, you should wear the mask, etc., etc. If you need oxygen, give the oxygen. Catheter should be passed because the patient cannot move. And the beds, beddings, it should be, bedding should be whatever we call the anti-sore bedding, that is called. That's anti-bed sores bedding. Mattresses are available. There are different type of equipments are available. General measures should be done. It will help a lot. Patient will definitely manage 20 to 30% with the general measures. The specific measures, number one, you do the fluid balance, that is water balance. So, secondly, electrolyte balance. Thirdly, you go to acid-base balance. So you have to do definitely the urea creatinine electrolytes and the arterial blood gases to manage the acid base. So there should be a caloric balance. ये 5 बैलेंस चाहिए होते हैं. अगर आप मरीज को आपको बचाना है, 5 तो बैलेंसेस हो गए, 5. उसके बाद स्पेसिफिक थेरेपी should be given. Intravenously, the broad spectrum drugs should be used in this patient. Broad spectrum antibiotics. Whatever available is available. If not available, do the triple regime. You have amoxicillin in your wards? Yes. You have metronidazole in your ward? Yes. And you have gentamicin, very cheap drug, in your ward. This is called triple regime. In the common hospital, we do triple regime because of the non-availability of the funds for going of the third generation cephalosporins, for example, the imipenems, carbapenems, azoturams, macrolides, and the third generation quinolones, new drugs which are coming. Very, very costly drugs. Definitely management, strategy is about costing about 40, 50, 60,000 in 7 days for the drugs only. Specific measures also doing, you do to maintain the shock if you are not able to handle the shock. In addition to it, so you give the drugs, nootropic agents. For example, dopamine, dobutamine, can be helpful in certain cases, not all. And in certain cases, steroids are indicated, not all. For example, in a coronavirus infection, in a coronavirus septecemia, that is, they are using the suppression of the immune system because immune system are misguided, I will say, hyperactive, leading the patient to the DIC and leading to the patient to the ARDS, and then the patient survived on the ventilator. If the MODS or hemophagocytic syndrome is avoided, the patient can be, you can take out the patient from the ventilator, otherwise the patient will die. If I am repeating like this. The symptomatic measure means that the patient is in symptom, for example, pain. He has got pleuritic, she has got a very severe pleuritic chest pain. For the pain, you have to reduce the pain. It is the right of the patient to do it. This is one example which I have given. Pain. And pain is now a vital sign. Fifth vital sign, remember. Preventive measures to you and your patient. For both of them are important. If there is vaccination available, do the vaccine afterwards or write it down. The patient should afterwards should be vaccinated for the pneumococci, for example, or meningococci, or Haemophilus influenza. And then the patient was able, because nasogastric tube has been passed, after a few days he will be out of the nasogastric tube. And then you go for the dietary measures. What type of the diet should be provided? Minimum calorie requirement to live with is 900 to 1000 calories. How much protein should be given, how much carbohydrate and how much lipid is given should be planned to save the patient from the dehydration on the one hand and the malnutrition on the other hand. Local measure means that the patient, if it is benefited by the physiotherapy, do it. Because to avoid these patients are prone to develop the fibrothrombosis or deep vein thrombosis, avoid this. And then surgical measures indicated, for example, abscess should be drained, carbuncle should be drained surgically. And that is epidural abscess can be drained. Surgical measures, if indicated, first of all, the patient should come out from the shocked state. And after the shocked state, the patient will be transferred for the surgical intervention. Now these are actually what I have told you just now are the stories and the management. I can speak on this part, the management which is written, many hours. I don't want to discuss because people do not listening or watching my videos. The subscribers, I have about 270 only. Take my one lecture and listen to it and try to convince the other people to watch this video. My last video, which I have given the terminologies. Then you give me the marks out of 10. The feedback. How much I gain now. You can then understand the value of this video lectures, which I am on the internet. I am delivering. I'm the single person who is delivering like this. One day after one day after one day. I don't know how much I have given, about 171 lectures till now in about 5 or 6 months. It means about 26 lectures a month I have delivered. And that is of course a record in Pakistan. One person is doing a lecture, 26 lectures a month. I am doing it for the nation, for the people, not to gain any popularity or anything I wanted from the government or a private sector or from you. Only Please pray for my health, and that's all. وما علينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.